Cerebral palsy, symptoms, causes and treatment. Today I am going to talk about a very critical topic that has affected 17 to 18 million lives globally. Well, 1 in 345 children have been diagnosed with it in the United States. It is one of the most common motor disabilities in childhood, affecting movement, posture, and muscle coordination. It is cerebral palsy. In today's video, I will discuss what exactly cerebral palsy is, what causes it, and how can it be treated or managed. Hello everyone, a very warm good morning. I am Dr. Madhavi Vaish from Bharat Homeopathy. I have extensive clinical knowledge and experience in treating brain disorders with natural and holistic treatment. So let's move on to the main topic. What is cerebral palsy? So now the very important question is, what is cerebral palsy? Cerebral palsy is a neurological disorder that affects muscle tone, movement and motor skills. It is not a single condition but a group of disorders caused by abnormal brain development or damage to the developing brain. This usually occurs before birth, during birth, or in the early years of life. One more important thing about cerebral palsy is that it is a non-progressive disorder. It means cerebral palsy does not get worse over time, but the symptoms may change as a child grows because muscle control and movement change. Types of cerebral palsy. Now let's move on to the types of cerebral palsy so you can gain a clear understanding. The first type is spastic cerebral palsy. It is the most common, affecting about 70 to 80% of people with it. It causes stiff muscles and exaggerated reflexes. It can affect one side of the body, that is hemiplegia, both the legs, that is diplegia, or the entire body, that is quadriplegia. The second type is dyskinetic cerebral palsy. It involves uncontrollable movements, often slow and twisting. It affects hands, arms, legs, and sometimes the face also. Now, the third type is ataxic cerebral palsy. It is a rare condition that involves problem with balance and coordination. Children may walk unsteadily and have difficulty with precise tasks like writing or buttoning clothes. The fourth type is mixed cerebral palsy. It involves the combination of symptoms of all other types of cerebral palsy. Now, what are the symptoms of cerebral palsy? Now, let's discuss a very important part of this video. It is about the symptoms of cerebral palsy. I will first talk about its motor symptoms. Delays in reaching motor milestones like sitting, crawling or walking. The second is muscle tone abnormalities. Muscle can be too stiff, that is spasticity, or too floppy, that is hypotonia. The third is uncoordinated or involuntary movements. It can include tremors, jerky movements, or difficulty with balance and coordination. A child may have an unusual walking style, such as walking on toes, a scissored gait, or a crouched gait. A child may have trouble with swallowing or speaking even. Well, it is about motor symptoms. Other non-motor symptoms are seizures, vision or hearing impairments, intellectual disabilities, and chronic pain. What are the causes of cerebral palsy? So now the important question is, what are the causes of cerebral palsy? Cerebral palsy happens when the brain develops abnormally or suffers damage. This damage may happen at any time of the birth. It could be before birth, during the birth, or even just after the birth. What could be its prenatal causes? Let's discuss some of its prenatal causes. They could be genetic mutation affecting brain development, maternal infections during pregnancy like rubella or cytomegalovirus, lack of oxygen supply to the fetus, or exposure to toxins or radiations. What could be its perinatal causes? Let's discuss some of its perinatal causes. I mean the causes during birth. They could be complicated or prolonged labor, premature birth, low birth weight, or lack of oxygen during delivery. What could be its postnatal causes? Now let's come to the causes that can affect the child after birth. They could be brain infections like meningitis or encephalitis, head injuries in early childhood, or severe jaundice in newborns. Treatment. Cerebral palsy has no treatment in traditional medicine, but it can be managed and treated with natural and holistic care along with physiotherapy, occupational therapy, yoga, meditation, and proper counseling. I hope you found my video helpful. Please like and share it with others who might benefit, and don't forget to subscribe to the Bharat Homeopathy YouTube channel and press the bell icon below to stay tuned for more health related information. Thank you.